Welcome, and thank you for joining us for this evening's Q&A session about the COVID vaccine, which has been organised by the British Pakistan Foundation. My name is Rahila Zakir. I'm a consultant eye surgeon at the Western Eye Hospital, Imperial College NHS Trust, and I'm also an honorary clinical senior lecturer at Imperial College London. My role this evening is to direct your questions to our panel of experts. So our aim this evening is to encourage people from the BAME communities to know the facts about the COVID vaccine and to have the information that they feel that they need to be able to make an informed choice about having the vaccine. We want to give an opportunity to all of you to learn more and to address any of the misinformation out there and to answer the questions that the headlines may have raised in your minds. So please do use the Q&A chat box for your questions, and it therefore gives me great pleasure to introduce you to our panel of experts. So first of all, I'd like to start by introducing Dr. Samia Latif. She is a consultant in communicable disease control at the Public Health England body. She's Assistant Academic Registrar for the UK's Faculty of Public Health and a member of the faculty's Global Health Committee and the Special Interest Groups on Pakistan, Mental Health, Diversity and Equality, and Global Violence Prevention. She also chairs Public Health England's BAME network. Her areas of interest are health protection, culturally intelligent leadership, global public health, and public mental health. She's a keen advocate for gender and race equality and is the UK Diaspora Lead for Women in Global Health Pakistan. Second speaker is Dr. Raqib Ali, who's a Senior Clinical Research Associate at the MRC, or Medical Research Council Epidemiology at the University of Cambridge. He's also the Director of Public Health Research Centre at the New York University, Abu Dhabi, where he is also Principal Investigator and Associate Research Professor. During the pandemic, he's also worked at the clinical frontline and has seen the impact of coronavirus in our populations. Dr. Imran Kausar is Medical Director for Novartis Gene Therapies UK. His main role is to develop gene-based therapies for rare conditions. He has extensive experience in developing clinical trials and working with regulators and is very well placed to answer all your questions about vaccine development and the research. Imran's a medical doctor by training and has specialized in anesthesia and intensive care, and he's based in London. So with no further ado, what I would like to do is go on and just going to see if any questions have come in already. But while we're waiting for your questions to come in, I thought it would be nice for us to just understand a little bit about vaccine fundamentals, really just focusing on vaccine development and vaccine safety. So I'd like to invite Imran to start by, talking a little bit about what the vaccine is made of. We've heard so many stories and it's difficult to know what the truth is. We've never really paid attention to what's involved with vaccines in the past ever before.
Thank you very much, Rahila. Assalamu alaikum, everyone. It's a pleasure to be here today. So today I'm representing the British Islamic Medical Association, and they've done a lot of work across many communities just to help improve the understanding of the development of vaccines and to answer some of the common questions that come up. And I can say quite easily, one of the most common questions that we receive related to the development of vaccines is, how on earth have they been developed so quickly and have corners been cut? Has something happened that has meant that these vaccines have been studied less in depth or with less rigor than we would normally expect? And I can say with complete comfort and ease as a professional who develops medicines and as a doctor that actually no corners at all have been cut. But it's easy to say that and to ask people to believe it. But actually, let me provide some further information behind it. Normal medicine development, and this is for any medicine, Rahila, not just vaccines, but any medicine, goes through a series of stages of experimentation that starts off with animals to make sure that the medicine is safe and that it's doing what you might want it to do. And then once you're happy that actually the data suggests this is safe and it's working, then you move to the next phase, which is often called phase 1. And this is where you develop the medicine and trial it in healthy individuals. Once you have certainty of effect and that it's not causing any side effects, Then you move to the next phase, which is phase 2, which is usually to get the right dose, but also you try it in a very large group of patients. Once you have the dose corrected, then you move on to the final phase, which is phase 3. Phase 3 studies are very large studies. They're often conducted in many countries around the world. And it's the data from all of the trials, but in particular the phase 3 trial, that is submitted to the regulators. The company can't decide to make the medicine available. It has to be submitted to the regulators who will provide an authorization. So that's the normal development of any medicines that you and I and others have taken, but also for vaccines as well. Now, you'll have noticed that what happens normally is it's sequential. One step finishes before the next step commences, and it goes on until it's finished. The difference that's happened with vaccine development for COVID is that all of those same steps have occurred. So everything has happened as would normally happen. The only difference is instead of doing it sequentially, it's happened in parallel. And there are a few things that have allowed it to happen in parallel. And one of the important things is the fact that there's so many patients with COVID. So normally with a particular condition, to get patients into the trial, you need to wait for that condition to evolve. As we know with COVID, actually a huge number of patients were affected globally, which meant it was actually easy to recruit patients into these trials and for those trials to finish quickly as well. Another thing is that normally companies develop medicines and they have a view on the market, how much money they need to invest versus what return. With COVID, the World Health Organization set up an organization called COVAX, which many of you will have heard of, which was a conglomeration of many countries and governments that came together to provide funding so that various risks that companies would have to undertake could be eliminated. And the risks we're talking about are not clinical risks. They're risks in building a factory which I might never have to use because my vaccine might not be approved. A company normally wouldn't take on that huge cost without some certainty. In this case, through the initiative of the World Health Organization, that funding was provided by governments to remove the risk and to allow the development of the medicines quicker. So, and of course, the third thing was the huge public need. This was an emergency situation, and so there was a strong multinational global connection between regulators and governments who all came together. All of that meant these sequences could happen in parallel, and they happened rapidly. But I think the key thing to remember is everything that would normally have been done for any medicines trial development has happened for every single one of the COVID vaccines. No corners have been cut, and the emergency has not meant that a lower standard of efficacy has been accepted. In fact, what's happened is that the trial results for the COVID vaccines that have been approved have been much higher than you normally would expect for what you'd accept for a trial for various vaccines. For example, if we look at the meningitis vaccines, or if we look at vaccines for other conditions, the trials are typically much smaller, plus also we're happier to accept results that are a bit lower. So I think the main message here is corners have not been cut. Large number of patients have been tested, so we have a very good signal of efficacy and a very good signal of safety. And it's not the companies that decide this, it's the regulators that decide the size of the trials. They review the data independently, and they make the decision as to whether this is safe for public use. And the determinant the regulators use is risk versus benefit. Is the risk of the condition that is meant to be stopped greater than the benefit, the risk should be less than the benefit the medicine is providing. The medicine should have a clear benefit, and that's the parameter they use.
And of course, there have been loads of vaccines that were developed, and only a few of them actually passed all the trials. So, that's really reassuring that we don't have a whole load of vaccines on the market. We have a few, but the ones that we have actually have, succeeded in all those rigorous trials and tests.
That is right. And in fact, the development of medicines for these vaccines has really stretched the boundaries of our science and has really pushed us not just to try new things, but also to try established things. So if you look at the vaccines that have come out of China, for example, they use a more traditional base approach, which is perfectly fine. And from the data that's published, it appears to have a reasonable degree of efficacy. But of course, with the newer vaccines, particularly the Pfizer, the Moderna, and the Oxford ones, they use a technology which is novel. And that probably explains why we're seeing such a high level. So it's allowed science to be really pushed to its boundaries, but in a safe way.
So I'm going to come back to the novel aspect of these vaccines in a while, but you touched upon efficacy, which is how effective a vaccine is, how well does it do the job that it's meant to do, versus safety when you're talking about the risk versus benefit. And a lot of the questions that come up in people's minds at the moment are around safety of the vaccines. Now, as doctors, all of us on the panel know that everything in medicine has its benefits and it has risks of side effects as well. And we generally accept that for almost every treatment that we take, even paracetamol for a headache, actually, that can also have risks of side effects. So could you talk a little bit to the specifics of the side effect profile of the vaccines that we have available to us at the moment, please?
Sure. So side effects are described in many different ways. And so they're expected side effects and they're unexpected side effects. And of course, both are of interest to medicines developers and to regulators. So let's talk about expected side effects. So these are side effects that are reasonably predictable based on how the medicine is put together or how it is given. So for example, when you inject somebody in the arm, you expect them to have arm pain. It's a very common thing and most people can predict that. And so of course, all of these are injected into the arm, the currently approved ones. So it's no surprise that arm pain is one of the most complained of adverse events or side effects that is quoted. And then there's the mechanism. What is the medicine doing to the body? And how does the body respond to that? And of course, in all of these instances, we're putting in proteins through some form or other, which is intended to generate a reaction. That's the whole point. Yeah. We're preparing the body for a future attack by the coronavirus or the COVID vaccine, about the COVID virus. And so as the body prepares itself, you see a set of side effects which are fully expected related to its preparation. So here we're talking about headaches, we're talking about perhaps a bit of fever, we're talking about some muscle pain. And so again, very common things. And if anybody has children and they've been vaccinated or immunized recently, you'll know that these flu-like symptoms, as they're often called, are very common. And in most instances are managed quite simply with some paracetamol. So those are the expected side effects, and by far account for the bulk of all the side effects that are known about across all three of the UK approved vaccines. That's the Oxford AstraZeneca one, the Pfizer one, and the Moderna one. And then there's a series of unexpected side effects. Now, unexpected side effects by their very name are unexpected, so they're not necessarily explained by the medicine, by the vaccine in the way that it's given or what it contains. And these unexpected vaccines are a factor of two things. They're a factor of time, and they're a factor of the number of patients who've been exposed, so the number of patients who've received it. So what that means is that the longer you wait, the more side effects you'll hear of, because they're a factor of time. So for example, there's some medicines that you take where side effects don't happen straight away, but they happen weeks or sometimes months after they're given. So time is one factor. And the second factor is the number of patients that it's given to. So if you have a medicine that's given to a small number of patients, you will only hear of a few side effects. But as you increase that number, so the exposure goes up, then you hear of more things. So what we have in the case of the coronavirus vaccines is that a huge number of patients are being vaccinated across the world. And as time goes by, we'll hear more. So it's absolutely no surprise that some of these unexpected side effects are being uncovered now. And of course, initially there was the allergic reactions to the Pfizer vaccine. So that's an expected reaction. And of course, that's why vigilance was there, and it came up so quickly. And then you have the ones that are coming out today, which related to the Oxford AstraZeneca one, related to forms of thrombosis. So again, that's exposure and time. And it's almost certain, simply by the fact that so many people will be vaccinated, that we will hear more of these things as time goes by. Now, the regulators and the medicines manufacturers know this, and there are set processes in place to understand each new report that comes through and understanding, is it related to the medicine? Is it related to the condition? Or is it related to something else? Would this happen even if the vaccine wasn't given? And so what's important in this whole thing for everyone to remember is, if you have a side effect, to report it, because that's the only way that regulators and companies will know about it. And of course, in the UK, we have a very robust system of medicines reporting, and for anyone that receives a vaccine, they'll be informed about where to report it, and on the websites there's information that's provided as well. So the reporting of side effects is an important feature of capturing this information, and then the regulators will review it and decide whether actually this is related to the medicine or whether it's not, or whether it's too early to say. But again, at the back of everyone's mind should be, is the risk of getting COVID greater than the risk of the side effect that might be being uncovered? And so we should expect these as time goes by. And again, this is not unique to the vaccines. Every week and every month, the UK regulator produces a report of medicines where new side effects have been reported. It's available on their website. This is a normal part of using medicines in large populations. It's perfectly normal to receive these reports. We just have to understand each one, and individuals, if they're concerned about a particular side effect, should have a discussion with their healthcare professional to understand its relevance to them.
I just wanted to ask whether Raghib or Samia, did you want to add anything to that? Then my next question is going to be from the our viewers' Q&A. It'll be obviously around specifically the AstraZeneca effects on clotting that are currently in the news. But if either of you wanted to add anything to what we've discussed so far. Samia?
I think I'd really like to just echo what Imran has said regarding vaccines and their side effects. And we know that vaccines are the single most effective intervention known to man in healthcare, and the safest by far. I think we need to look at the perspective of balance the risk and the advantages. Now, we've had globally the number of deaths that we've had across the world for COVID. We've had over 2 million deaths across the world. We've had over 129 million cases globally, and just in the UK, we know that we've had nearly 126,000 deaths to speak. So we're talking huge, large numbers. And what's important also, I think, when it comes, and I know you're going to touch on the Astra and the clotting, which a few people have posted in the chat or the question and answer section. What it is important to understand is that COVID itself can cause clotting, and COVID can be fatal. And the vaccine far outweighs any risk that there is. We've had a few cases reported, I think about 11 cases reported to the European Medicines Agency, and a handful of cases reported to UK authorities of these clotting disorders. But usually in a month, we see about 3,000 new cases of these clotting disorders in the UK. So it's very hard to link whether it's the vaccine that's caused them. It's like, if I've had the vaccine today and I go outside and I try and cross the road and I get run over by a bus, did I get run over because I was vaccinated? It's sort of that sort of thing. I'm not dismissing the fact that, yes, we have heard and there have been cases of clotting, but the link and whether they're directly linked, it'll take a while to prove. And I think Imran hit it on the head when he said it's about time and exposure. So given time, we will learn more about it. But the benefit of the vaccine far, far outweighs any risk that we know. So I just wanted to add onto that point. Thank you. Rahila, I think you're on mute.
I'm sorry, did you want to add anything there?
Lip reading what you said, so I'll just add briefly. I mean, as Dr. Rahila mentioned, I did go, well, I mainly did do research. I had gone back to work in A&E during the first and second waves of the pandemic. And although many of us will know people who have either had COVID or even been hospitalized or even died from it, not all of us do. And I think it is important just to always go back to the fact that this is a disease which can affect people of all ages. I mean, I've seen patients in their 20s, 30s, 40s, particularly from younger patients from South Asian backgrounds, Pakistani backgrounds, where I work, and even young patients in intensive care. In fact, you're slightly more likely to go to intensive care, when you're younger, because there's a greater likelihood of having benefit from the treatment. But going to intensive care is an extremely unpleasant experience, and being on a ventilator, even if you're not on a ventilator, this is something which of course no one would want. And the worst case, of course, is that you can die from it. Although it's rare for young people to die from COVID, it's not unheard of. There have been cases. So that's the first thing. The second thing is that even if you don't end up in hospital, we've got a lot more evidence now about long COVID. So you may have seen even today, estimating that 1 million people in the UK have got long COVID, and about 10% of people still have symptoms even after 3 months, which is unusual. You don't usually get such a high rate of long-term side effects after flu, for example. So this is much more dangerous in the short term than flu. It has a much higher death rate than flu, much higher likelihood of getting into intensive care. but it also has a much higher long-term kind of problems, including extreme tiredness. I mean, there's people who used to be fully fit and now can't even climb a set of stairs, long-term breathlessness, so-called brain fog, where people are unable to concentrate or get back to work. And so that's why, it's so important that now that we do have a solution with the vaccine, and we can avoid all of those side effects and the possibility of ending up in intensive care or dying. I know at the moment the vaccine has only been offered to older age groups and those with underlying health conditions. So those aged over 50, or if you've got, for example, diabetes or hypertension, you may have been invited. But 75% of Pakistanis are aged under 50. So the majority have not been called yet. Of course, children have not been invited yet either, but even amongst the adults, more than half have not been invited yet. And I would encourage, whether it's yourself or family members who haven't been invited yet, particularly from younger age groups, to encourage them to take part, both to save themselves from things like long COVID, but also to make sure we don't end up in this kind of lockdown situation again. So if everyone gets vaccinated, then we'll achieve something called, it's commonly referred to as herd immunity or population immunity. Once you reach that threshold, it's very hard for the virus to spread in the future. So we want to avoid the situation we have to go back into lockdowns again, which has a particularly harmful impact on young people and our community.
Okay. So as I understand it, we are, Samia has, addressed the issue of the number of people who would be expected to get clots in a year anyway, and we're still at a stage of working out whether there's an increase in this number as a result of vaccines. So I think from the media perspective, possibly this is a big correlation, but from an evidence-based perspective, based on, from a medical perspective, we still can't say anything more about it, but it doesn't seem to be so at the moment. So one of the other questions that has come up is the risk of death or serious side effects from the different vaccines. Is there anything specific that we know about serious side effects or death? I'm not aware of a risk of death myself.
Maybe I can just comment on that. So people are particularly interested, of course, in the AstraZeneca vaccine. That's had most of the adverse publicity. The UK has given the most doses of the AstraZeneca vaccine of any country in the world, and through the yellow card system, which was already mentioned, where we collect data on side effects, they actually haven't found this increased risk of this particular type of clotting disorder that has been reported, for example, in Germany. And given that we've got the highest number of people that have been given the vaccine, you would have expected to have showed up in our data. And the UK actually has a very good system through primary care and through pharmacies, hospitals, etc., in collecting this data. So it seems unlikely that this side effect is really linked to the vaccine. I mean, people are having this condition, of course, but based on the UK data, the MHRA, the regulatory authority that deal with medicines regulation and approvals, they have said that there's no evidence to link it. And even, I think yesterday, the European Medicines Agency again said they did not have evidence to show that these two things were linked, and they were clear that the benefit of the vaccine outweighed the risk. So again, I would encourage whoever is offered the vaccine not to be overly worried about these reports. I mean, more people have had these vaccines in the last year than have had flu vaccines over many years, and more people have taken part in these clinical trials than any other vaccine actually in history. So we actually have a huge amount of information now. And the AstraZeneca trial, for example, they reported last week in the US, they didn't have any deaths in the link to the vaccine. So that's, again, reassuring.
One of the questions is about where the public can find information about, I'll call it side effects from the different vaccines. When I was just hearing things in the media, I was pretty overwhelmed, and it seemed like a scary place to be. But when I then looked in the medical literature and the medical fora, I then, found the information that had the evidence, and it was a big relief. But obviously, the non-medical public doesn't have access to that. So are there, through the government website or public health websites, are there websites that provide this information for people to go and find out for themselves?
Yeah, so I think what we've discovered is that since coronavirus has entered the public consciousness and is the dominant conversation in the world, really, it's also come along with an information pandemic, in that there's a lot of information that's spread everywhere, multiple analyses, the need for news channels to want to talk about this non-stop, and that's confusing, because occasionally the information can be contradictory, and in some cases it's deliberately incorrect, and so it can be very difficult for people, particularly for those who do not want or need to have a scientific education, to actually understand what is factually correct and what is spurious or distorted. And I think this is a big problem, and will continue to be a big problem. So I think people need to become very clear about where they're sourcing their information from, and to define a group of trusted sources. Now, in the UK, the vast majority of information on which a decision made is public. So in fact, for all the medicines that have been approved, there's all the full summaries of information are available online on the government website, of which the MHRA is part. It's fully public, anyone can have a look at it. And there's also a document for some of the medicines called a public assessment report, which goes into real detail into all the information that the regulators use to decide, including the number of severe cases, the number of side effects that were reported, etc. That's fully available. It's a lot of information, and for many people it might be too difficult to access or just not understandable. And so in which case we have to look at other sources, and then there are multiple organizations that are providing summaries or lay or understandable. The BBC does an excellent job of producing it. Local councils are producing some information as well. And there are a variety of organizations that are providing information in different languages. Again, similarly at the British Islamic Muslim Association, Medical Association, we produce we produce this information in summarized form in a variety of different languages, which people can access and make it understandable. So I think for people, yes, the information is there. What you should do is actually find a trusted source to try and get access to that information, particularly if you require it in a different language.
Thank you. So just going back to our questions coming in from our viewers, one of the other things is around the younger women in the community expressing concerns that taking the vaccine can affect the ability to give birth. So this is the fertility issue, and whether we could address that. Now, at the moment, obviously, the vaccine's being offered mainly to people over the age of 50, and only the people who've got other underlying health conditions are being offered it at a younger age. So I suppose the younger women getting vaccines at the moment certainly are probably being offered it because they're at risk from other conditions as well. Samia or Raghib or Imran, can I invite you to respond to that concern?
Yes, I can start. I think Raghib, you can come in. So for the question that's been asked is around, sorry, are we just discussing the fertility or the pregnant ladies?
Well, both actually. I suppose it comes under all the same, the group,
Yeah. So when trials for vaccines are usually conducted, they won't be done on pregnant women. However, during the course of trials, some females, of course, may just become pregnant. But from the data that we have, we cannot categorically say that it should be given to those ladies who are pregnant. However, because of the risks that COVID poses to someone who is pregnant, when your body is catering for two people and your immunity may be a bit low. So if you suffer from a condition which further lowers your immunity, your specialist who is in charge of your condition, if you are, for example, a cancer patient on chemotherapy drugs, or you're immune suppressed due to some other condition, your clinical specialist will make a balanced judgment call, discuss it with yourself, and then see whether the benefit of the vaccine outweighs any risks. And it can be given to pregnant women, but only under the advice of your specialist. And regarding the fertility thing, there is no evidence whatsoever from any of the vaccines that are in the market globally that I have seen, and colleagues can correct me, that it affects females' fertility. So if you're planning to conceive a child, there is no reason you shouldn't have the vaccine. The vaccine actually may protect you, and it's then again about protecting yourself and protecting your loved ones. Raghib and Imran, do you want to add to that?
Just one point I would add. I mean, one of the badly affected groups in the pandemic have been pregnant women. So if you get COVID while you're pregnant, it's actually, there's fairly good evidence that causes worse outcomes. And I've seen cases myself of pregnant women that have ended up in intensive care, and very sadly, some have even died. So that's always important to bear in mind as well. If you are thinking of becoming pregnant in the near future and you're offered the vaccine, it's definitely a good idea to take it.
Okay.
And similarly, as you said, Samia, that in the trials, pregnant patients aren't routinely admitted because of the risks and benefits. And so during the course of the trial, some patients do become pregnant, and we have evidence there, and there's nothing to suggest that it caused any harmful effect in those patients. And with regards to fertility, again, for most medicines, fertility is assessed in animal studies beforehand. So you can check in male and female animals of reproductive age whether there is any effect. And for all the vaccines that have been trialed, certainly in the animal studies, there's no evidence to suggest that fertility should be impaired or impacted. And so that gives us belief to feel that there shouldn't be an additional risk, and certainly nothing to do with fertility that we're aware of, or that the science suggests should be the case. And similarly with pregnant patients, although there hasn't been any formal trials in these populations, the evidence suggests it shouldn't be for everyone. It's on a case-by-case basis. So if there's a particular patient who is pregnant, they should discuss that with their clinician to understand the risks of vaccination, where there is information versus any other risks the patient possesses, and make a decision on a case-by-case basis.
Okay. All right, I'm going to change the line of questions at the moment. We haven't addressed one of the earlier questions. These vaccines are based, certainly in the UK, the ones we're using, on what we call novel technology. It's the mRNA vaccine, and it's very new. Even I wasn't quite sure what was involved, and you sort of wonder, why didn't we just go ahead and use the vaccines the way we always did? Why did we have to use new technology? So I suppose one question would be, why did we use new technology? And then the second would be, does this new technology actually affect your own DNA in any way?
So I can answer the second question first, because that's the easier one to answer. It's a quicker one. So do they affect your DNA? Not at all. So the amounts of, let's understand what we're talking about here so we're all clear. Our bodies respond to a signal that they receive when a foreign invader comes in, and they create antibodies to that foreign invader. And of course, the foreign invader in this case is the COVID virus. Now, in order to stimulate the body to prepare itself for such an attack, you give a vaccine, and that vaccine creates the protein that allows the body to prepare itself. So it gives it a first look of the virus before the virus even gets there, which means the body's able to prepare itself. Now, there's lots of different ways to give it that first look. And you can actually, in the older vaccines, you would actually take a part of the virus itself, inactivate it, and put that in, and the body would learn to recognize the virus. Improvements of understanding in genetics and genomics, an area that I work in every single day, has meant that we've understand the coding of these proteins, the genetics of it. And the genetics are instructions that come in two forms, but essentially they're broadly similar. They're either called DNA instructions or RNA instructions. And so we've harnessed a way to be able to give the instruction without giving the virus. And the body takes that instruction and mimics a part of the viral protein. So, and that's really clever. So instead of having to give the viral protein, we can give the instruction to the body to mimic and to create the protein. It creates it, and then the body's own defense system says, hang on, this is new. I don't recognize this. I'll start creating antibodies towards it. And that's the job of the first dose. And it prepares its immune system. So it gets ready for a future attack. And so why we're using DNA and RNA is because actually they're rapid and efficient. And they can be, in some instances, they can be much easily produced. For example, we've seen with the Oxford AstraZeneca one, we're able to produce very large amounts of that, and we can mobilize it quite easily. The Moderna Pfizer one's a little bit more complicated. That's not to do with DNA, RNA. It's to do with the way that they transport that into the body. But there's a crucial difference and benefit compared to any other type of vaccine using DNA and RNA. And you've got to really look ahead. We're all very delighted that in the UK that, so many of the population have been vaccinated. And even as of this week, we've seen the benefits of that with Europe's tightening its restrictions on its populations, the UK is loosening them up because a large proportion of our population has been vaccinated. But we all know now the next threat for us is the variants. Okay, these mutations that occur naturally in the virus. And we know from the studies that not all the vaccines provide the strongest level of protection against these new variants. And like the flu vaccine, where we need annual boosters, we will absolutely require boosters of the COVID vaccines as well. We should get used to that. But here's where the big difference is. With DNA and RNA vaccines, you can create those new boosters much more easily. And in fact, as soon as the new variants were identified, the companies began creating the secondary sets. And so we're now seeing trials beginning for booster vaccines, particularly for the RNA ones, but also the DNA ones as well. So it's a new technology. We kind of, for those that look at the development of vaccines, this is the 5th big development, and it's a major development. And so we're really lucky that this is happening at a time where we can benefit from those. But we should be reassured, this does not in any way affect our DNA and RNA. Actually, this DNA RNA instruction that we've given breaks down quite quickly. So it needs to be taken up by the muscles where it's given to start producing it. And if it's not taken up, it gets broken down quite quickly. But they do not integrate at all. They perform their function. They mimic this viral protein, and then they're broken down and they're gone.
Excellent. That's really helpful to know. One of the questions that's come in, which I think we've sort of answered, about people who've had organ transplants, and is it safe for them to receive the vaccine? And I think, what was said earlier on in the responses was that anyone with a serious underlying condition will have a conversation with their clinician to discuss the risks and benefits of having the vaccine. And in most cases, I think the vaccine will probably be thought to be protective. But again, it's a case-by-case discussion with your specialist about that. So one of the other questions is, do we know how much GPs are paid for each patient that receives both doses of the COVID vaccine jab that's been administered? My understanding was that they are paid probably something like 10 or 12 pounds per vaccine. This is absolutely in no way, as far as I can tell, a money-making exercise. In fact, many people are volunteering their time and additional shifts to make sure that this vaccine has the rollout and the ability for everyone who wants it to have it. If any of you know anything from a GP perspective and primary care perspective, please do contribute to that.
I mean, just to add, none of us here are GPs, and my rationale for encouraging people to vaccine, there's no benefit to me. But as I said, I've seen too many people suffering and dying from this condition, and that's really the only reason why we're encouraging people to get the vaccine. And then the GPs that I do know who are working hard in this area, it's the same for them. They're all giving a lot of their free time, weekends, evenings, particularly to encourage people from our communities to take part. As I said, they're not being paid for that at all, the additional work they do. So it's just reimbursement of their time and personnel that, of course, that has to be reimbursed for giving the vaccine.
Yeah, I mean, it's a massive logistical exercise in terms of identifying your population, inviting them, and delivering the injections and keeping a record. And I think I have to say, the NHS has really pulled through in this. It just shows what an amazing organisation it is. I feel really proud to be part of it. Some of the other questions, so somebody was asking specifically, we've talked about the mRNA vaccines, which are the Moderna and the Pfizer vaccine, but someone would like to know, how do the adenovirus vector vaccines work? Now, when we say vector, what we mean by vector is the carrier that carries the relevant particle into the body or into another organism. So the adenovirus, I believe, acts as a vector, as a carrier molecule or a carrier organism to take a molecule into the body in the vaccine. So Imran, would you be the right person to tell us about that?
Yeah, again, this is my day job. So you described it beautifully, Rahila. Actually, I call the vectors, they're Ubers. They're just transporters.
Yes.
And actually all they're doing is transporting the genetic information, this RNA and DNA that we've been talking about. And vector science is a relatively new science, but of course viruses are the pristine vectors. They've been on the planet for billions of years, and it is their job to carry their own natural DNA and RNA around. That's all what they've been doing for the longest time, far longer than we've been around. And so it's been a scientific experiment to say, can we use viruses to transport the DNA and RNA of interest to us. So that's what we mean when we say vector. It's just the Uber, it's the transporter of these of this genetic information. The adenovirus, and specifically that's the chimpanzee adenovirus, which the AstraZeneca vaccine uses. It's called a chimpanzee adenovirus, not because it comes from chimpanzees, it's because it's an adenovirus, which is a type of virus, which is commonly infects chimpanzees, but it's not from a chimpanzee. It just happens to be a virus that affects chimpanzees. And what the team at Oxford have done is to take that chimpanzee adenovirus, remove its natural genetic material, and replace it with the genetic information that will mimic the coronavirus. And that's what it's done. And then you use that, and because it's a tiny, tiny molecule, it's 20 nanometers in diameter, it can travel very easily into the body, carrying this genetic information into the cells. And the Pfizer and the Moderna vaccines don't use a viral vector. They use what's called a lipid nanoparticle. So it's like a drop of oil, and it's a specifically formed drop of oil which contains the genetic instruction inside it. So it's entirely synthetic. And in fact, the drop of oil is made of cholesterol. It's a plant-based cholesterol. It's an extremely tiny amount of cholesterol. You can see 0.3 of a mil is how much you're given, and it carries the instruction. And what's important about that is, one is that because it's an oil, it has to be stored in a specific temperature, which is why we see that the Pfizer vaccine has to be kept at -80 degrees. It's for the stability of this particular lipid nanoparticle. But that's what we mean when we say vectors. They're just carriers of information, and the Oxford one is a type of viral vector called an adenovirus, and they're very well studied for this purpose. And this is not the first adenovirus used for this purpose either. The team managed to make this quickly because they were making it already for other infections around the world. So they just switched it from that virus to COVID.
So I've got another question. I'm going to start with Samia, but also, so this one will be a public health related question. And then before we finish, because we're coming to the end of the webinar, I'm going to also just bring up the question around Ramadan is around the corner. It's going to be here soon. And if people are getting invitations for their first dose, they might be concerned. So I'll come back to that question. But first of all, Samia, one of the questions we've got is, if the vaccine doesn't prevent you from getting COVID, and it doesn't prevent the transmission of COVID, and it doesn't protect you if the virus mutates, then, why should I have the vaccine? Which is, reasonable question to ask.
Yes, that's very right. Okay, so basically, the vaccine will protect you far more than if you weren't vaccinated. So we know with the current vaccines that are being given in the UK and mostly around most of the world, actually, that by the time you've had your 2 doses and you've given it a few weeks post your second dose, you should be receiving protection in the figures of 80% or above for the majority of vaccines. No vaccine has ever been 100% foolproof. Nothing in life is 100%, but this is the best tool we have at our disposal to protect ourselves and our loved ones. And with I think you've had the vaccine, but you can still harbor the virus in your nose and in the mucosa around your nose, and therefore you can still transmit it to other people. But the intention is that gradually, as the vaccine program is rolled out, we will have the majority of the country will be covered, and we will have a certain degree of herd immunity resulting from the vaccine, which should be able to protect us all. So that is, in theory, what we are hoping. But when I say that the vaccine is but one tool in our armory, I think what we must be always cognizant of, or always remember, is that we still need to think about hands, space, and ventilate. Everyone probably has heard it to death now, but wash your hands with warm water, running warm water, 20 seconds with soap. Soap and warm water is the best thing, no substitute, unless you don't have access to water and soap, and then you use a hand sanitizer. Keep that 2 meters or more distance in busy places or when you're outdoors, and sort of ventilate your homes and shopping centers. And I know when we come to Ramadan, we'll be talking about ventilating mosques as well. So you need to do all of that along with the vaccination, and that is our best bet. I hope I've answered it, but if anyone wants to add on, please do.
I was just going to add, I mean, the premise of the question, of course, is not correct, because as Simon said, there's very good evidence that it reduces your risk of getting COVID by about 90%, death and hospitalization by around the same once you've had both doses. There's also quite a lot of evidence now that it reduces transmission. So we've got data from the UK as well as from Israel and other countries to show a reduction in transmission as well. And the other good thing is that the vaccine has been shown to be effective against definitely the Kent variant, which is the most common in the UK. It's also been shown today, there's data out showing that the Pfizer vaccine is also equally effective against the South Africa variant. So they are effective against the variants that we've got at the moment. And if the virus does mutate in the future, the vaccines can be adapted. And we do this every year with flu, with influenza. So every year, the reason you have a different vaccine every year for influenza is because it mutates. In fact, it mutates more than coronavirus. Coronaviruses don't mutate as quickly as influenza. So I know there has been, I understand why people ask questions like this. There's a lot of misinformation out there. And I've seen that a particular video that has that same question in it, saying, well, if it doesn't do these three things, why am I taking it? But it's just false, basically. So it does reduce your risk of COVID, it does reduce risk transmission, it does protect you against variants. Just if you don't mind, Ryan, just to answer a couple of things that were in the,
go ahead.
Chat. So again, someone's asked about why cases is going up in the US when they've had a lot of vaccination. But that's not true again. I mean, cases in the US have gone down significantly over the last few weeks, as they have in the UK as well. But there is an issue with people sometimes letting their guard down soon after having the vaccine. So you would have seen some high profile cases of people being diagnosed with COVID the day after having the vaccine or 2 days after having the vaccine. So those are, of course, because they got COVID before they were vaccinated, because it takes a few days to show symptoms and for the test to be positive. But other cases where people got it maybe 2 weeks after or 10 days after is often because they've been less careful after taking the vaccine. So I would encourage everyone to make sure you wait. Well, you should be careful anyway, as Dr. Samia said, but particularly in the first 2 weeks after taking the vaccine, there's really very little protection. And the final point I just wanted to say, someone has again reasonably asked about the deaths that have been recorded in people that have taken the vaccine. And it's just to reiterate, 30 million people have had nearly 30 million people have had their vaccine. So if anything that was given to 30 million people, even, Smarties or a sweet or something, some of those people would die, because people die naturally, unfortunately, and particularly amongst the elderly. So that most, those deaths have been looked at by the MHRA, and none of them have been linked to the vaccine itself. They are deaths that occurred naturally for other causes. And I've seen cases like that myself, patients that have come into hospital extremely unwell from their usual medical conditions, and sadly they've died, and they happen to have had the vaccine as well, but they died from their underlying condition.
And following on from that, actually, there's also the question around civil liability for the vaccine manufacturers. But I understand that although the pharmaceutical company may be immune from civil liability, or whatever the liability is, governments have been quite robust in taking responsibility. Is that right? I just didn't want to ignore that question.
Yeah, this is an issue that causes a lot of concern. It's actually a legal issue. It's not a medical issue, or it's not because the government knows something will go on, or they're trying to hoodwink everybody into making a decision, which is flawed. The issue is that we all know when we buy something we have rights, and the law affords us those rights. When it comes to vaccines, none of us actually buy the vaccines. It's the government that buys it on our behalf. And because they buy it on our behalf, they take on the risk. And because potentially if something could happen, because a lot of unknown information, the government has a mechanism that allows individuals, because they can't take any action against a company if that was the right thing to do. And so the government has to create a program, and that's a vaccine damage payment scheme. And it's simply because of that, because none of us are actually physically paying for it. And so the liability needs to be managed. Now, this is an old scheme. It runs for every single immunization program that occurs. And in fact, it's in anything. If you go to the NHS and experience harm, then you have the right under the law for recourse. And this is the simple thing for that as well. It's not a new thing. automatically any vaccine will be covered, whether it's for COVID or flu or for anything else. So it's a myth to imagine that there's part of a bigger conspiracy or a scheme. It's not. It's just it's a legal framework that has existed for a very long time.
Excellent. So before we finish, I don't want to miss the opportunity to talk about, for those of our viewers who are observing Ramadan when it comes up and will be fasting, they may have questions around if they've got a date for their first dose or their second dose, but it falls on a day when they would be fasting. You know, does taking a vaccine break the fast? What's the permissibility around having the vaccine during Ramadan?
So I'm happy to take that one. I mean, this is not my opinion, but it's the opinion of Muslim kind of jurists and scholars and doctors who have worked together to work out the answer to this question. And the consensus opinion is that it does not break your fast. So the only thing that would break a fast is something which either passes through your mouth or is nutrition. So if you had, for example, an injection of something which had nutritional value, which the vaccine does not. So there's general agreement across all schools of thought, all scholars, that the vaccine is fine to be taken. I think the other concern, which I understand, is that, of course, the vaccine can have some short-term side effects. I mean, I had some, fever, headache, fatigue for a couple of days as well. So I'm not going to pretend that there's no side effects at all, short-term side effects. And you may be concerned, or people may be concerned, that they're going to miss a fast because of that. But again, it's weighing up the pros and cons of that. And the advice I have seen, again, from Muslim scholars and imams, is that you should take the vaccine. If you become ill, then of course you have the allowance to skip those fasts. And as Allah says in the Quran, you make up those days later. So that is a well-established allowance. So we shouldn't be worried about that. By protecting yourself, and particularly for younger people, one of the reasons that South Asians, Pakistanis, Bangladeshis particularly, have had higher death rates is because we are much more likely to live in multi-generational households, much more likely to interact with our elderly relatives. And of course, all of us, the last thing we want is to infect our elderly relatives. And during Ramadan, we may be meeting up more frequently than we had been previously. So by taking the vaccine ourselves, we will be protecting them as well. Excellent.
All right. Let me see. There was somebody who has had their first dose. I think, actually, Sami, I think you answered that question, didn't you? There was also some concerns that there are some videos around showing longer term side effects in animal models. I haven't seen these videos. I just tend not to look at any of this. But is there anything that we can talk? I mean, we have talked about side effects and risks and these things. And I think some of this is a possibility of this could happen or that could happen. And then it all gets packaged up into a this is what happens kind of thing.
Yeah, I mean, look, fear mongering is common and the COVID situation is by no means unique. Many of us will remember that even before this, we've had issues with measles. And so there's a long history of communities being concerned, and that's not to say concerns should be ignored. There are good reasons why people are concerned, but it's not unique to the COVID vaccines. Indeed, it's not unique to this part of healthcare. There are lots of scare stories around from many parts of healthcare. With a specific issue related to the videos, I haven't seen anything, but what I would say is this. So many people have been vaccinated now that if there was a true signal of anything that turned up in animal studies, for a start, they wouldn't have progressed. They would have been stopped at that point. If there was anything genuinely there, it would have been picked up in those phase 1, 2, 3 studies that I mentioned, which number into the 20,000 plus people that have been injected there. And then, of course, subsequent to that, as Raghib, Sami, and yourself have said, many millions of people have now been vaccinated. We would have identified something by now. So I think we need to be careful on what information we're getting in. And it comes back to that, only go to a trusted source for information. If you see a WhatsApp message and you think it could be reasonable, resist the temptation to forward it on. Go and do your own research from a trusted source before making a conclusion. And sadly, don't believe everything you read.
Okay, excellent. So, Saima, I think you'll tell me that we are now coming to a close. It's 6 p.m. I would just like to say thank you very much to Samia Latif, to Dr. Raghib Ali, to Dr. Imran Kausar, Dr. Samia Latif, and also to the British Pakistan Foundation for organizing the webinar. There will be still many, many questions, and I'm sure that we haven't answered all of them, but I hope that some of them have been answered. And the information is out there. If you have further questions, please do use the email address that was given in the original webinar link to send them in, and we'll do our best to respond. And if you have any suggestions for any further webinars and information that you'd like to have addressed specifically, please do let the British Pakistan Foundation know. Simon, if there's anything else you'd like to ask, or if any of the panel members would like to add anything.
Just to say that the British Islamic Medical Association has a lot of resource on their website. It's got Ramadan guides, it's got, it's got responses to many myths, and they're in multiple languages as well. So please make sure you visit www.britishima.org.
Could I echo that? Actually, I found the BIMA COVID repository amazing. In fact, one of the questions I answered was from their infographics, and they've got it in so many languages. It's a really, really good resource.
Brilliant. Okay, good. And those of you who don't know about the British Pakistan Foundation, it was founded in 2010. It's London-based, it's not for profit, it is secular and bipartisan, and runs programs nationwide in partnership with local community building organizations working for the BAME community. And whilst boosting community building, the BPF also acts as a liaison between the diaspora and governmental and non-governmental organizations in both the UK and Pakistan. So once again, thank you very much for listening, and I hope that it's been useful.